predictor of addiction. This graph by researcher Moreno shows that not only can family have an impact on addiction, but addiction can also have an impact on families, with 76% of past addicts and relatives saying that it has had some impact on their relationship with their family.
Solution 1. Create a better relationship between family members to prevent future addictions. The first solution, which I have here, is one way to do this solution is by creating a better bond between your family members. You can do this by spending time together, like going to an amusement park or playing games together in an arcade. Doing this will create a better relationship between you and your parents, which, as shown on this graph, can have a major impact on substance addiction in people. As said by Mark J. Van Ryzen et al., youth-focused components designed to encourage more positive family relationships emerged as key factors predicting larger than average effect sizes. Our results suggest that adding or expanding certain youth-focused components may be able to enhance program efficacy. The other part of Solution 1. This part of Solution 1 is about how families can enforce at an early age the negative effects of addiction. Using the healthy relationships created by families by spending time together and other things, parents can encourage their children not to do drugs by explaining how the negative effects that drugs have on people. And this is using the family's good relationship to have the children, when parents explaining, to listen to their parents, because if they had a bad relationship, the children wouldn't pay attention much. But by having a better relationship, it allows for children to ingrain this in their brain, that how negative drugs are on human beings. As previously said, that by L.A., that rejection and non-acceptance within the family environment emerge as crucial predictors of addiction. So creating a better relationship between families can help to reduce addiction.
Okay. So now we have Solution 2, which is including family and rehabilitation efforts for current addicts. So the goal of implementing family members into these recovery efforts are that they would most likely be able to work through solutions with the addict or help them gain access to useful recovery programs. The ethical appeal that family members bring to these types of situations also makes them helpful in diverting the addicts away from addiction. Through their already existing familiarity with each other, addicts are more likely to trust and listen to the solutions that their family members present. Pei Hong from Central China Normal University writes that it is found that the motivation for drug rehabilitation is stimulated under the guidance and restriction of family ethics based on obligation and responsibility. Hong et al. 2021. In all, this solution can be positive for both the addict and the family if the situation is handled right. So while there are some helpful implications to the solution, there can also be some negative limitations. So including family in addiction rehabilitation can present several challenges, like having toxic initial family dynamics, such as enabling behaviors, can hamper progress while a lack of understanding of conflicts within family can also create additional stress for the addict, which can possibly cause a relapse in their addiction. Additionally, returning to a stressful home can make recovery even more difficult, and family members' own mental health issues or denial can further complicate the process and lead to a worsened family dynamic. Moreover, without proper education and support services for families, they could possibly feel as if they were unable to provide any form of support and create actual progress. Also, family members may be unwilling to associate themselves with the addict because they're unwilling to lose social status. For these reasons, addicts may become even more demoralized and unwilling to turn away from addiction than before family was presented in the situation.
Alright, so after a bit of research, we determined that including family in rehabilitation is actually the best method. So essentially research from multiple sources shows that when family is involved, the recovery success and rate of relapse becomes way better for the participants. So the most effective application of this is the CRAFT model, which stands for Community Reinforcement Approach in Family Training, which essentially focuses on involving the parents and the family more into their addict's recovery, which then in turn will encourage them to enter treatment. So, as seen by this graph right here, produced by Dutcher et al. Through extensive quantitative research, the success of the CRAFT model is over 60%, which is more than double of individual-only approaches. So this goes beyond, with family function becoming stronger, according to drugfree.org, as their communications become better, their trust rebuilds, and there becomes a stabler home environment compared to when they were on drugs. So the thing that's so special about the CRAFT method is that it doesn't just aim to fix the problem, it actually targets specific family dynamics that influence addiction. So by them rebuilding their bond, as I said, they build better trust, they re-engage in communication, they'll become friendlier with each other, ensuring that the family dynamics that could have initially caused the drug addiction will cease to exist. So, in summary, CRAFT offers it's very measurable and research-backed, and it helps people enter treatment more often, according to Jessica Steven et al. And M. Archer et al. It supports lasting recovery and strengthens the entire family system while rehabilitating the drug addict. And here's a bibliography.
Fantastic.